6:50, right. I am really worried that I haven't cheered you up enough on this show so far tonight. So let's talk about the quademic. That's not one, not two, not three, but four nasty viruses all going round at the same time. There is flu, cold, cough, pant, ugh. There's COVID. Well, we all know about COVID, but by now mostly it isn't so different from flu in the way you feel, cough, fever, headaches and so on. There is RSV, or Respiratory Syncytial Virus, cold, cough, pant, etc. And just for fun, there is also norovirus, throw up, run for the loo, repeat. Put the four nasties together, and even if they're not quite the four horsemen of the apocalypse, they are very bad news for the NHS this winter, because cases of flu, for instance, are up by 350% compared to the same week last year, norovirus up by 85%, and so on. Dr. Bharat Pankania is Senior Clinical Lecturer in Public Health at the University of Exeter Medical School. Dr. Pankania, thank you very much for joining me. This is a really bad-looking winter for the NHS, is it not?
Yes, it is. And Andrew, I sort of despair because a lot of this is vaccine preventable. I've been in the business for at least 35 years in this speciality, and we have this every year. I feel we can do better, and we must do better, because a lot of this is logistics, immunize, protect, prevent.
Well, you say we must do better with vaccines. I went and had a flu vaccine and a COVID vaccine, indeed, a few weeks ago. And there was an enormous queue out of the chemist where I had it. Lots and lots of people waiting patiently, sometimes for hours, to get their vaccines. So, you know, my experience is an awful lot of people are desperate for vaccines.
It's really good to hear that, you know, there was that long queue at the pharmacist to get vaccines. Unfortunately, nationally, this is not the case, especially so in the care homes where we have these vulnerable people who are obviously not even going to queue up. And then worse still, Andrew, this really bothers me, is healthcare workers, people who should know better. The uptake of vaccines amongst them is pretty low. It's abysmally low. And you know, I feel as doctors, we know what we know, but we don't know what we don't know. And maybe we need other experts to bring in to answer for us. Why is the uptake amongst healthcare workers so low? And with regard to care homes, nursing homes, those vulnerable people who cannot necessarily queue up outside pharmacies, I want to know, why can't we get our act together to immunize, to have peak immunity at the same time as when the virus is also peaking?
Well, those are really good questions, Dr. Pankania. What about the rarity of having these particular four viruses all at the same time? Is this unusual?
No, not at all. This is a regular occurrence over the winter period. We have poor ventilation, crowded offices, crowded places. Infection transmits through the aerosol route. People get infected, people get ill. Vulnerable people, unfortunately, end up in hospital.
All right, Dr. Pankani, a very important warning for people listening. It's never too late to get vaccinated. Thank you very much for that.